Red and itchy patches on the skin may be due to urticaria. Know how to get quick, safe and effective relief from urticaria symptoms by renowned dermatologist of India and Guwahati, Dr. Kirti Jodhani. Doctor, is urticaria and allergy similar? How serious is urticaria?
Allergy is basically a hyperreactive response to a stimulus which might not usually affect a person normally. But urticaria is a form of allergic skin condition where an individual presents with red swellings all over the body or over particular parts of the body. It is quite itchy in nature, and sometimes it could be accompanied with swelling of the lips and eyes if it is severe condition. In India, it has been seen that once in a lifetime, 1 out of every 5 individuals they face these conditions. Chronic urticaria, that is urticaria which lasts for more than 6 weeks, has been found to affect around 1% of the population of India.
Doctor, what are the causes of urticaria and aggravating factors?
So urticaria has a variety of causes. The most important cause which we should all look out for is infection. A simple throat, respiratory, dental or urinary tract infection could also lead to urticaria. Sometimes we have people who have urticaria and also they complain of gastric problems. There is an organism called Helicobacter pylori which should be tested out for. Then the next common cause is drugs, that is a medicine. Who could think of that the most common drug which we take like paracetamol could also lead to urticaria. Then certain antibiotics like cephalosporin group of drugs, tetracycline group of drugs. If the urticaria is chronic, that is if it lasts for a very long time, then we should rule out some systemic conditions also.
Doctor, if someone takes a lot of medicine for cardiac and diabetes issues, is there any safe medication for them?
Generation antihistaminics are safe, but if asked to name one, fexofenadine is a safe drug which can be used in people who have urticaria with comorbidities. If the comorbidities are present, we could start with a lower dose, that is 120 mg, whereas the standard dose is 180 mg in a 60 kg healthy adult. And if the person does not respond, then we could increase the dose gradually with proper monitoring of the comorbidity condition which the patient has. And if the urticaria is chronic, that is if it lasts for a very long time, for more than 6 weeks, then we should rule out some systemic conditions also like thyroid disorders as well as diabetes mellitus.
Doctor, how to take care of my skin to stay away from skin problems this summer?
So your summer skincare should be very simple. The AM routine, that is the morning routine, should be you should cleanse your face with a face wash, moisturize it with a very light based lotion based moisturizer and top it up with a sunscreen. The sunscreen should have a minimum SPF of 30. In case you have a pigmented skin, it should have a minimum SPF of 50 and a PA star of 3+. Above all, you should always use an umbrella or broad brimmed hats whenever you are outdoors. Then at night time, you should cleanse your face with a face wash and again top it up with a moisturizer which is very light lotion based. You should always wear light colored cotton clothes.
Doctor, I can see a lot of people having acne breakouts. How to take care of skin to prevent acne breakouts?
So people with frequent acne breakouts should always have their hormone levels tested. Nowadays, PCOD, that is polycystic ovarian disease, has become very common among young female adolescents. They should also have their skincare products evaluated, which products, which sunscreen, face wash, moisturizer they are using. In case of people with acne, they should use a mild salicylic acid based face wash. They should use light gel based moisturizers and sunscreen. Gels containing clindamycin are safe for people with mild acne. In cases of people who have severe acne, they should always get themselves consulted.
Doctor, what are the causes of urticaria and aggravating factors?
So urticaria has a variety of causes. The most important cause which we should all look out for is infection. A simple throat, respiratory, dental or urinary tract infection could also lead to urticaria. Sometimes we have people who have urticaria and also they complain of gastric problems. There is an organism called Helicobacter pylori which should be tested out for. Then the next common cause is drugs, that is a medicine. Who could think of that the most common drug which we take like paracetamol could also lead to urticaria. Then certain antibiotics like cephalosporin group of drugs, tetracycline group of drugs. If the urticaria is chronic, that is if it lasts for a very long time, then we should rule out some systemic conditions also.
A public awareness initiative from Dermachem, a division of Alchem Laboratories Limited.